During this pandemic, doctors across the country started noticing a reaction to the coronavirus in some children. What they said resembled Kawasaki disease now has a name: multisystem inflammatory syndrome, or MIS-C.
It attacks sort of the immune system and is attacking different parts of the body and affecting different organs.
It's unclear why in some children the immune system overreacts.
There are over 13,000 children in Louisiana who are diagnosed with COVID-19, and only a very small subset of those have MIS-C. So when you look at the majority of kids, they make a full recovery.
And while it is a small subset of children, look at this CDC map. Louisiana is one of the top 8 states with MIS-C cases. LSU Health physical medicine and rehabilitation physician Dr. Scott Schultz says after children recover, there can be health problems.
But we do have children who have persistent lingering symptoms.
So, doctor, what are these children suffering from physically and emotionally?
Whether it's that they can't play basketball as well as their peers because they're deconditioned, whether they feel anxious because of having COVID and the stigma associated with their peers, or if they're having problems with memory, processing, and brain fogginess, we want to get them back to where they were.
So last week, Children's Hospital opened a specialized outpatient rehabilitation unit. It's similar to this physical therapy unit for children with other conditions. The new clinic is the first and only post-COVID-19 rehab in the state and region. Dr. Schultz will work alongside psychologists and physical therapists to return children to full health.
Our goal is to optimize function when they get back into the home, school, community environments. We want these kids to thrive
and help their families get them through this tough time. Meg Farris, Eyewitness News, Medical Watch.